Bismillahirrahmanirrahim. Assalamu alaikum students. How you people are? Okay, let's start today's lecture. Today we are going to study the mandible, and this is the mandible bone in front of you. This is the mandible bone, and this is forming the lower jaw and lower jaw, and this is the only bone of the skull which is the largest one, and articulates with the here. Okay, let me turn on the brush, and from here. Okay, so its temporomandibular joint is formed over here. So this is the bone of the skull which is forming the joint, largest bone of the skull, which is articulating with the skull over the temporal bone, and it is forming the lower jaw. So this is the jaw, this is the lower jaw. You people can see that there are the sockets for the teeth. There are these sockets for the teeth. The teeth attach over in these sockets. So these are the sockets for the teeth. So this is the lower jaw, and 16 sockets are here. Okay. So let's start. This is mandible. Mandible has three parts basically. Okay, this is the body of the mandible. Okay, and this is the ramus of the mandible. One, two, and this is the other ramus of the mandible. Three. Okay, these are the parts. One, two, and three. These three are the parts of the mandible. Okay, body, ramus, and ramus, and the body and where the body and the ramus meet, it's the angle of the mandible. Okay, this is the angle of the mandible. This is the body of the mandible, this is the ramus of the mandible, and this is the angle of the mandible. Okay, we will discuss one by one each aspect, each point. Okay, first we will discuss the body. Let's discuss about the body of the ramus. This is the body of the mandible. Okay, body of the mandible. If we are talking about the body of the mandible, in the midline here we can see some elevation over here, not so big, some bone like this over here. So this is a point where the right and the left both meet, and the medial joint is formed, which is called the Symphysis manti. Symphysis manti. Why it is called symphysis manti? Because it's in the middle. It's in the middle. That's why it is called the manti. And symphysis, it is the symphysis joint. It's not some bony joint or cartilaginous joint. It's a symphysis. Okay. And in newborns, it is very. Yeah, you can say the joint. These two bones are not fused, but in elderly, this bone is. This is considered just a single bone, and this point is called the symphysis manti. Okay, I will go into another pic, so that yes, this picture, in this picture many things are clear, so we will discuss with this picture. So this is the symphysis manti, and if we go into detail about the anterior aspect of this mandible bone, we will discuss some points. Okay, so let me clear it again on. Okay, so there is some elevation on the two sides of the symphysis manti. There is some elevation which is called the mental protuberance. You know, some if there is some elevation on the bone, it is called the protuberance. So we will say this is the mental protuberance. This is the protuberance, and inside it there is the symphysis manti. Okay, these 3 points about the medial part of the outer part of the mandible. Okay, let me tell you about this foramen. This foramen is located on the where the second premolar tooth is present. There is some foramen which is called the mental foramen. This foramen is for the inferior alveolar nerve and inferior alveolar vessels. Okay, inferior alveolar inferior alveolar nerve and inferior alveolar vessels. This foramen is called the mental foramen. It is related to the inferior alveolar nerve and inferior alveolar vessels. Okay, now we have to move to the medial part. So you can see this is the outer part, this one is the outer part, this one is the outer part. So we will move into the medial part. This is the medial part. So this is the medial part of the sorry, this is the medial part of the mandible. So we will discuss the aspects, the protuberance, the elevation, the foramen present over the medial part. Okay, the first, and the first we will discuss, where is the brush? Okay, so in the center you can see, in this is the central point, this is the point where the symphysis menti is on the external side, and on the internal side there is the mental spine. On the external side there you can see symphysis menti, and on the medial side, on the medial side you can see this mental spine. This is the mental spine over here. Okay, after mental spine you can see mylohyoid line, where this is the mylohyoid line. This is the mylohyoid line, and this line is an elevation on the bone. You can see from, maybe you can feel that there is some elevation on the bone, and it's called the mylohyoid line. Sorry, this is called the mylohyoid line. And on the line, this is some depression is over here, and some depression over here, and over here too. Okay, some depressions are present around the mylohyoid line. Let me draw this line again. Okay, so this is the line which is called the mylohyoid line. So you can see a depression over here. This depression is for the sub, this first I will tell you its name. Is the submandibular fossa. What is the name of this fossa? This is the submandibular fossa. This is the submandibular fossa. What is it for? It is for the salivary gland. Which salivary gland? The submandibular salivary gland. The superficial part of the submandibular salivary gland is present over here. That's why it is called the submandibular fossa. This is the mylohyoid line, this is the mental spine, and this is the mylohyoid line. And on the posterior part of the, on you can say the lateral part of the posterior part of the mylohyoid line, you can see a depression which is called the submandibular fossa. And in the submandibular fossa, the salivary gland, which salivary gland? The submandibular salivary gland is present. Okay, so on the anterior part of this, you can see a depression over here too. This depression is for the sublingual gland, which is also a salivary gland. Sublingual gland. Sublingual gland is also a salivary gland. So that's why this fossa is called the sublingual fossa. This is the sublingual fossa, and the this is the submandibular fossa, and this line is called the mylohyoid line. Okay, this is the mylohyoid line, this is the submandibular fossa, and this is the sublingual fossa, and this is the mental spine. Okay, mental spine is present medially, and on external side you can see the symphysis menti. I guess it's clear. Let's move forward. Okay, now I should move some, okay, yeah, we can see from here. Yeah, in this picture it's clear that this upper part of the body is called the alveolar arch, because it's the sockets of the teeth are present over here, and that's why it's alveolar, inferior alveolar or alveolar arch you can say. And this one is the base, this one is the base. Okay, this one is the base, and this one is the alveolar arch. And let me tell you something about the base. On the base, let me clear it. Okay, now again. On the base you can see a depression over here, and on other side too depression over here. This is basically digestic fossa. Digestic fossa is for digestic muscle attached over this point, and that's why their depression is over here, and this depression is called the digestic fossa. Okay, this is for the digestic muscle. When you will study the muscles of the neck, you will study the muscles of the digestic, and the digestic muscle is attached over here, and that's why this fossa is called the digestic fossa. Okay, again we will move on the ramus. So we are clear about the body, so we will move toward the ramus of this mandible. So this is the ramus of the mandible. Okay, this is the this point is the angle. This point is the angle of the mandible, and this is the ramus of the mandible. Okay, so if we talk about the ramus of the mandible, we can see two processes over here. One anterior, this one is the anterior, you can see it is anterior. This is called the coronoid fossa, and this one is the posterior. This is the styloid process. This is the styloid process. Let me clear. This is the okay, this is the stellar process, and this is the coronoid process. Okay, this is the coronoid process, and this is the stellar process. And let me tell you that the stellar process for the temporomandibular joint, where it articulates with the temporal bone and forms the temporomandibular joint at it is also called the head. Okay, this part is also called the head of this ramus, and this is the coronoid process. Okay, and between the coronoid process and between the condylar part, there is a foramen present over here. You can see a depression present over here. This depression is called the mandibular notch. This depression is called the mandibular notch. Okay, let's discuss again about the ramus. The ramus has two processes. One is the coronal process, and one is the condylar process. And between the coronoid and the condylar process, there is some mandibular notch present. Okay, and let me tell you something about the collar brush on. Okay, this is the condylar part. Condylar part also has a neck. This is the neck of the condylar part. This one is the neck. This one is the neck, which is you can say some shrunken, and this elevated part, this raised part, is the condylar part. And between it, there is the mandibular notch, and this is the coronoid process. Okay, now we are discussing the details of this ramus. This ramus. Let me see. Is there any? No, I can see that. Yeah, over here. Over here. Let me zoom it for you. Okay. Yeah. Okay. Now we will see that there is a lingula. This depression, you can see this depression. Basically, this depression is the mandibular. Is this depression? This depression is for the mandibular lower alveolar arch. Let me tell you, mandibular. It will okay. This is the mandibular foramen. This is the mandibular foramen, and it opens in the mandibular canal, and this canal leads into the mental foramen, which we discussed in earlier. This is the mental foramen. You can see. So it if we move, this is another view. So in this view, we will see that over here, moving from here and comes over here. So what I told you, that coming out of the mental foramen, it was the lower alveolar lodge of vessels and nerve, and these vessels and nerves are moving from here till here, from foramen till canal, and this foramen. Let me draw it over here. Suppose this is the foramen and this is canal, mandibular canal, and this is the mental foramen. So it's moving over here. I will show you in another pic which is very clear. Not here, yes, over here. You can easily see that this mandibular foramen is over here, and from mandibular foramen the mandibular canal is over here, and it opens in the mental foramen, and from the mental foramen the branches move forward, which are incisive branches. Okay, so this is all root of the inferior alveolar vessels and nerves. These are moving from the mental foramen, mandibular foramen, and mandibular canal, and mental foramen, and inferior alveolar vessels and nerves moves outward, and now they are called the incisive canal. Okay, so this was, I guess, every aspect is completed. Let me, nothing is left. No, I have told you everything. So thank you so much. Okay, Allah Hafiz.